Hi, I am so happy to meet you in the program of JIP's Horse and Heart News. For past 1 week, patient in ICU had been receiving injection meropenem for the management of fever was turned out to be CRE. What do you mean by CRE? So CRE is nothing but carbapenem resistant enterobacteria. In that patient, the culture isolated that patient was harboring carbapenem resistant Klebsiella pneumonia. So what is CRE? So it is carbapenem resistant enterobacteria. So some of the enterobacteria including E. coli and Klebsiella and Pseudomonas which are showing strong resistance against carbapenem, which we consider one of the last resort antibiotic against gram-negative bacteria. So when will you suspect CRE? Yes. The patient who has been hospitalized for a long time and receiving broad-spectrum antibiotic and receiving meropenem but not responding to meropenem, and when you receive patient with a history of fever from another hospital, then think of CRE. So of course the culture will isolate carbapenem resistant enterobacteria. It's very important is how will you treat? When you suspect or when you have culture which reveals carbapenem resistant enterobacteria, the drug of choice would be injection ceftazidime with avibactam and astronam. So why you add astronam? It has been found that the CRE or carbapenem resistant enterobacteria produces many enzymes which deactivates meropenem and imipenem like all carbapenems. So the enzymes include, you have the enzymes that are oxy-48, the enzymes New Delhi metallolactamase, and you have the carbamase secreted by Klebsiella pneumonia. But among all these enzymes, please remember that this New Delhi metalloproteinase can even deactivate ceftazidime and ceftazidime and avibactam. So to inhibit this New Delhi metalloproteinase secreted by metallolactamase secreted by the CRE will be deactivated by astronam. So what I want to insist that even though you add simply ceftazidime alone, then ceftazidime may not act against some of the carbamase enzymes secreted by CRE. So you need to add astronam to counteract these enzymes secreted by SRE. So whenever you find CRE, always choose ceftazidime with avibactam and astronam as well. In Indian setup, it has been found that the most important the carbamase secreted by CRE is New Delhi metallolactamase, for which we add astronam to counteract that enzyme. That's very important. Astronam, where it is clinically useful, sometimes astronam would be very useful those who develop allergic to cephalosporin and penicillin. So when somebody has history of type 1 hypersensitivity reaction against penicillin or cephalosporin, you can choose astronam as an antibiotic. So with that, I want to conclude. Thank you.